7 Side Effects of Apple Cider Vinegar. Hi, welcome to Health Place. Before we get started, be sure to click the subscription button and turn on the notification bell. Now you will not miss any important updates coming from Health Place. Apple cider vinegar is a natural tonic. It has several health benefits that scientific studies in humans support. However, people have also raised concerns about its safety and possible side effects. In this video, we are going to share with you 7 the potential side effects of apple cider vinegar, and also instructions on how to consume apple cider vinegar safely. 7 side effects of apple cider vinegar. 1. Delayed stomach emptying. Apple cider vinegar reduces the rate at which food leaves the stomach and enters the lower digestive tract, which helps to prevent blood sugar spikes. Its absorption into the bloodstream is slowed as a result. This effect, however, may aggravate symptoms of gastroparesis, a common condition that affects diabetics, because the nerves in the stomach do not function properly in gastroparesis. Food remains in the stomach for an extended period of time and is not emptied at a normal rate. Heartburn, bloating, and nausea are all symptoms of gastroparesis. Timing insulin with meals is difficult for type 1 diabetics with gastroparesis because it is difficult to predict how long food will take to digest and absorb. 2. Digestive side effects. Some people may experience unpleasant digestive symptoms after consuming apple cider vinegar. Apple cider vinegar and acetic acid have been shown in human and animal studies to reduce appetite and promote feelings of fullness, resulting in a natural reduction in calorie intake. However, one controlled study suggests that indigestion may reduce appetite and food intake in some cases. People who drank a drink containing 25 grams of apple cider vinegar reported less appetite but also significantly more nausea, especially when the vinegar was mixed with an unpleasant tasting drink. 3. Low potassium levels and bone loss. There are currently no controlled studies on the effects of apple cider vinegar on blood potassium levels and bone health. However, one case report of low blood potassium and bone loss was attributed to long-term use of large doses of apple cider vinegar. 4. Erosion of tooth enamel. Acidic foods and beverages have been shown in studies to erode tooth enamel, although soft drinks and fruit juices have received more attention. Some research indicates that the acetic acid in vinegar may also harm tooth enamel. The acetic acid in vinegar may weaken dental enamel, resulting in mineral loss and tooth decay. 5. Throat burns. Apple cider vinegar has the potential to burn the esophagus or throat. Acetic acid from vinegar was found to be the most common acid that caused throat burns in a review of harmful liquids accidentally swallowed by children. Researchers recommended vinegar be considered a potent caustic substance and kept in child-proof containers. There have been no reported cases of throat burns caused by apple cider vinegar. However, according to one case report, an apple cider vinegar tablet caused burns after becoming lodged in a woman's throat. The woman claimed she was in pain and had difficulty swallowing for 6 months after the incident. 6. Skin burns. Apple cider vinegar can also cause skin burns because of its highly acidic nature. In one example, a 14-year-old girl got erosions on her nose after using a procedure she saw on the internet to remove 2 moles with few drops of apple cider vinegar. In another case, a 6-year-old boy with multiple health issues developed leg burns after his mother used apple cider vinegar to treat a leg infection. There are also numerous anecdotal accounts of burns produced by putting apple cider vinegar on the skin on the internet. 7. Drug interactions. Some medications may interact with apple cider vinegar, including insulin, digoxin, and certain diuretics. How to consume apple cider vinegar safely. Most people can safely consume reasonable amounts of apple cider vinegar by following these general guidelines. Limit your intake. Start with a smaller amount and gradually work up to a maximum of 2 tablespoons, 30 milliliters, per day, depending on your personal tolerance. Minimize your tooth exposure to acetic acid. Try diluting the vinegar in water and drinking it through a straw. Rinse your mouth. Rinse with water after taking it. To prevent further enamel damage, wait at least 30 minutes before brushing your teeth. Consider avoiding it if you have gastroparesis. Avoid apple cider vinegar or limit the amount to 1 teaspoon, 5 milliliters, in water or salad dressing. Be aware of allergies. Allergies to apple cider vinegar are rare, but stop taking it immediately if you experience an allergic reaction and call your doctor. Finally, apple cider vinegar has several health advantages. However, to stay safe and avoid adverse effects, it is essential to watch the quantity you eat and take it carefully. While a modest bit of vinegar is beneficial, more is not always better and may even be detrimental.